Cyclospora infections are currently spreading in the United States and have attracted the attention of U.S. health authorities. According to the latest information from the CDC and the FDA's official investigation, the FDA has announced that it is investigating an outbreak affecting 5 states. The public has been advised not to eat shredded iceberg lettuce served at certain Taco Bell locations in Indiana, Kentucky, Michigan, Ohio, and West Virginia. The FDA is continuing to trace the source of the contaminated food. Since May 1st, 2026, the CDC has recorded 4,173 domestically acquired cases of cyclosporiasis that were confirmed through laboratory testing. The agency is also aware of more than 7,400 additional cases that have not yet been laboratory confirmed and require further investigation and analysis. This brings the total number of reported cases to more than 11,500 across the United States. Many of these cases have been reported in Michigan and Ohio. So, what is Cyclospora? How dangerous is it? And what should you do to protect yourself and your family? Cyclospora cayetanensis is a microscopic single-celled parasite that infects the human intestines. The illness caused by this parasite is called cyclosporiasis. People usually become infected by eating food or drinking water contaminated with the parasite. In the United States, previous cyclospora outbreaks have been associated with raw vegetables, salads, fresh herbs, cilantro, basil, berries, and many other types of fresh fruits and vegetables. Unlike many other gastrointestinal illnesses, Cyclospora does not usually spread directly from one person to another immediately. After the parasite is passed from an infected person through stool, it must go through a developmental stage in the environment for several days, or even several weeks, before it becomes capable of infecting another person. Symptoms usually begin about 1 week after a person eats contaminated food, although they may appear earlier or later. The most common symptom is prolonged diarrhea. Other symptoms may include stomach pain, bloating, nausea, loss of appetite, fatigue, weight loss, increased gas, and sometimes vomiting, or a low-grade fever. Without treatment, the illness may last for several days, several weeks, or even longer. Symptoms may improve temporarily and then return. For most healthy people, Cyclospora infection is usually not life-threatening. However, prolonged diarrhea can lead to dehydration, weakness, and significant weight loss. Older adults, young children, pregnant women, and people with weakened immune systems should be especially careful because they may have a higher risk of complications. If you experience prolonged diarrhea or signs of dehydration, such as dry mouth, dizziness, reduced urination, extreme weakness, or an inability to drink enough fluids, seek medical attention. You should also tell your doctor if you have recently eaten raw vegetables, salads, or food from an area affected by the outbreak. It is important to understand that routine stool tests do not always detect Cyclospora. Therefore, your doctor may need to order a specific test for this parasite. The most effective treatment is usually a prescription antibiotic recommended by a healthcare professional. You should not buy or take antibiotics on your own without first being examined and properly diagnosed. So, what can we do to reduce the risk of infection? A gastroenterologist shared this advice. There is no need to panic or completely stop eating vegetables. First, regularly follow updates and public health notices from the CDC and FDA. especially if you live in or travel within the United States. If health authorities identify a specific food product or batch that may be contaminated, stop eating it immediately and follow official instructions. Second, always wash your hands with soap and water before preparing food, before eating, and after using the bathroom. Third, wash fruits and vegetables thoroughly under clean running water. For leafy vegetables, remove the outer leaves. For fruits and vegetables with firm skins, use a clean produce brush to scrub the surface when appropriate. However, it is important to understand that washing produce cannot guarantee the complete removal of Cyclospora. Salt water, vinegar, and ordinary produce washing solutions have not been proven to completely kill this parasite. Fourth, prevent raw vegetables from coming into contact with raw meat or unclean kitchen surfaces in order to reduce the risk of cross-contamination. Finally, thoroughly cooking food remains the most effective way to kill Cyclospora. During an active outbreak, older adults and people at higher risk may consider eating cooked vegetables instead of raw vegetables. If you develop diarrhea, drink plenty of fluids, and use an oral rehydration solution to help prevent dehydration. Although Cyclospora is a microscopic parasite, the illness it causes can last for many weeks and significantly affect a person's health and daily life. The most important steps are to stay informed through official health agencies, choose food carefully, follow safe food handling practices, and seek medical care if you develop suspicious symptoms. By following a few simple but effective precautions, you can greatly reduce your risk of infection and protect the health of yourself and your entire family.